The Centers for Disease Control in the United States has reported sustained growth in new cases of sexually transmitted diseases year after year. Despite our best efforts to curb these trends, the rates continue to rise annually. When looking at the reasoning for this, our eyes turn to the efficacy of our current sex education curriculums. The Centers for Disease Control has identified 20 topics in sexual health education which they deem to be critical. These topics include, but are not limited to, communicating the benefits of remaining sexually abstinent, providing resources for accessing valid and reliable health information related to HIV, STDs, and pregnancy, communication and negotiation skills for reducing sexual risk, teaching about the relationship between intoxicants and sexual risk behaviors, such as how alcohol use can lead to an increase in sexual risk behaviors, the importance of using condoms in addition to other forms of birth control to reduce the risk of pregnancy and STDs, teaching students how to obtain condoms as well as wearing them correctly, contraceptive methods alternative to condoms, as well as discussing sexual orientation and gender identity in a positive light.
An example of the uneven implementation of sexual health curriculums. State legislation requires that students receive a sexual health education that discusses the prevention of pregnancy, HIV, and other STDs, yet these curricula are not required to be comprehensive, and they must stress the benefits of abstinence, specifically the concept that a monogamous heterosexual relationship is the best prevention strategy for both HIV and STDs. Additionally, there are no requirements to teach students about sexuality or gender expression. SEIC-US reports show that only 31.6% of students received an education in all 20 critical CDC concepts in grades 6 through 8. The percentage does, however, increase slightly to 42.8% when students reach high school. An example of the uneven implementation of sexual health curriculums. State legislation requires that students receive a sexual health education that discusses the prevention of pregnancy, HIV, and other STDs, yet these curricula are not required to be comprehensive, and they must stress the benefits of abstinence, specifically the concept that a monogamous heterosexual relationship is the best prevention strategy for both HIV and STDs. Additionally, there are no requirements to teach students about sexuality or gender expression. SEIC-US reports show that only 31.6% of students received an education in all 20 critical CDC concepts in grades 6 through 8. The percentage does, however, increase slightly to 42.8% when students reach high school.
Sex education is something of a hot-button issue in both political and public spheres. Opponents of comprehensive sex education often cite religious reasoning for a reason to abstain from teaching topics other than abstinence. Others believe that there is no way to reduce sexual risk, as all non-monogamous sex is high risk for developing STDs regardless of the use of contraceptives. While this debate is not black and white, it is often applied through that lens. There exist certain groups which claim that comprehensive sexual education is predatory, or that it sexualizes children by exposing them to this content. The general academic consensus does not align with that perception, though. The general academic consensus surrounding comprehensive sex education is that it is effective at producing the desired outcomes. These outcomes include, but are not limited to, a delay in the age of sexual debut, fewer sexual partners, fewer incidences of unprotected sexual intercourse, and increased use of contraceptives with partners, especially barrier contraceptives such as condoms. According to the CDC, these quality programs can also find methods of tying in other health-related concerns such as substance abuse, mental health awareness, and ways to prevent both committing and being victim to violent acts. These additional topics serve to increase students' academic performance in school by providing risk reduction tactics while also providing them with important resources for their own health. One of the most critical steps for the implementation of these comprehensive sexual education curriculum is increasing the public's receptivity to these concepts. American culture views sex as a very taboo topic. As such, bringing up these conversations often does not facilitate a healthy dialogue, especially when it involves children. The current implementation of comprehensive sex education curricula, as seen in this graph, has varied across the country because there is no federal standard for the curriculum. Content at age level varies as well. One cited complaint for curriculums is that they could discuss content that is not developmentally appropriate for the children. By applying a standard set of age-appropriate content at a federal level, there would be an increased likelihood of public acceptance for these concepts. It's also important to ensure that explicit language is used in the legislation. Current legislation simply gives school boards the option to implement these curriculums. However, it's left up to the individual school boards to decide whether or not they want to provide students with this information. This is likely due to Title V, Section 501B of the Social Security Act, which restricts funding to only schools with applicants only until marriage content structures. Repealing this legislation would open that avenue for schools to be able to implement these curricula without fear of losing funding for their programs, increasing the wider spread implementation. A crucial component that must not be compromised on with sexual health education is beginning these conversations early. While it's important to keep the content developmentally appropriate, the age of menarche, a girl's first period, has been steadily decreasing over the past decades, where women weren't reaching sexual maturity until the ages of 16, 14, or older in the past. Now the average age is 10 years old in America. Setting children up for success includes beginning these conversations before they are urgent and before they are experiencing the effects. According to the CDC, these quality sexual health education programs address the health needs of all students, including those who are members of the LGBT community, connect students to resources for their own health, fosters positive relationships with adults important in a child's life, and allows them to have open conversations relevant to their own health. And most importantly, these curricula are taught by trained teachers or school staff. Additionally, when specifically addressing condom use, but also applicable to other behaviors, the most effective method of instructing is the utilization of the theory of planned behavior. The theory of planned behavior is used to predict an individual's engagement in a behavior at a specific place and time, and focuses on behavioral intent, which is affected by a person's attitudes about the likelihood that a given behavior will provide the expected outcome, as well as the individual's subjective evaluation of the risk. This model is comprised of 6 constructs that represent an individual's control over their own behavior, and those include attitude, or the degree to which an individual has a favorable or unfavorable evaluation of the intended behavior, behavioral intention, or the motivational factors that influence the given behavior. Subjective norms are the beliefs about whether or not the people important to the individual would approve or disapprove of the behavior. Social norms are typical behaviors in the larger group. Perceived power is the perceived presence of factors that may impede or facilitate the behavior, and perceived behavioral control is the individual's perception of how easy or difficult it will be to perform this given behavior. By utilizing this model, students are empowered to use multiple decision-making or logical approaches to determine the best behavioral choice for their desired outcome, the key component being placing the control onto them.
Sex education is an important topic to address, and this instruction has lifelong effects for the students involved. Politicizing the debate or allowing personal beliefs to overshadow objective academic findings does more harm than good in the long run. By utilizing scientifically backed curricula to provide students with developmentally appropriate information about their own health, we will be able to reduce rates of sexually transmitted diseases, unplanned pregnancy, and other potential risks associated with risky sexual behaviors. All we need to do is to be able to address these conversations from a logical perspective.